Hi, I'm Georgie Price. I'm the Policy Officer at Social Enterprise Scotland. Thanks for joining me all today. I know it's a Monday morning, so it's not the best time. Just a little warning, I am not feeling amazing, so if I'm coughing, I apologise for that. But yes, let me just get things ready. So yeah, nice to see everyone's faces. I think some I haven't seen before, so welcome. Social Enterprise Scotland is the national intermediary organisation for social enterprise in Scotland. We're a membership-led organisation that seeks to represent, promote and champion the work of social enterprises. I'm sure you all know, but today's session's on health inequalities in Scotland, and we're joined by some of our speakers who are kind of going to talk about the research and what's being done in practice to address the gap. So I think we'll just start off, and then if anyone's late, we can just kind of let them in. But yeah, so first we're going to hear from Allison Catalano from the Fraser of Allander Institute on the recent report launched in November on the health gap. So Allison, if I just start sharing the slides and then you can kind of get going. Also, just one thing before we start, if the session's going to be recorded, so if anyone doesn't want to be kind of ask any questions on camera, you can message during the chat and we'll answer them at the end. But yeah, Alison, I'll start sharing now. Okay. Let me know if you can see that all right.
That's great. So as Georgie said, I'm Allison Catalano. I'm an economist at the Fraser of Allander Institute, which is an economic research association located within the University of Strathclyde. And back in November, we published a report that examines the parts of our lives that determine and interact with both personal and community health here in Scotland. So you want to go to the next one? Great. So in conducting this research, we looked at changes that had happened within Scotland, mostly around devolution back in 1999. So in particular, there were two major trends with Scotland's population health since then. So one, that there are large and persistent inequalities in health in Scotland, and two, that since 2012, Scotland's health has stagnated and failed to improve in any major way. And so these two trends have parallels within socioeconomic data as well. So if you want to go to the next slide. Namely, that where there are these large and persistent inequalities in health, there are also large and persistent inequalities in economic and social activities and participation. And at the same time, while population health has stagnated, so too have earnings and household incomes, especially since 2010 with austerity and the impacts of the Great Recession. So you want to go to the next one? So to look into these trends more thoroughly, we investigated 6 areas which inform the socioeconomic stagnation and inequality. Those 6 being listed over here, employment in the labor market, household financial circumstances, education, housing, public services and welfare, and the impact of neighborhoods and community. Our goal essentially, is to look at how these specific socioeconomic indicators developed in the past 10 to 20 years, again, in parallel with these changes in health. We also have examined how COVID-19 and the cost of living crisis impacted these indicators. So if you want to go to the next one. So on a positive note, since the early 1990s, employment rates for men and women have been converging, with women increasingly likely to have at least part-time employment. And men's employment, as you can see, sort of follows a very similar cyclical pattern over those years. The chart dips around recessionary periods in the 90s and early 2000s and during financial crises. One thing that's changed since the 90s, however, is that older men, so those nearing or right around pension age, are more likely to be working, whereas younger men are less likely to be in work. And younger people in general, we found, are more at risk of being underemployed, during this crucial period of their early career. So I want to go to the next one. And in spite of employment growth, however, income growth among full-time workers has largely stagnated since the financial crisis in 2008. So comparing to the long-term trend of real wage growth, which is to say, incomes after adjusting for inflation, incomes are about £80 per week lower than they would have been had we continued to follow this trend of income growth since the early 1980s. Next one. Sorry, I'm gonna go to the, thank you. So this wage stagnation has happened alongside a recent growth in overall poverty, recent being since around 2013. The number of people who are in work poverty has increased since the financial crisis, which is largely due to housing costs and also something to do with the definition of relative poverty. Notably, we've made really great strides in improving pensioner poverty, which has declined significantly since the 1990s. Child poverty rates have also fallen significantly since its peak in the 80s, but both of these have begun to increase since 2013. And child poverty remains higher than poverty in the general population. Rates of it vary pretty widely by region. Ayrshire and Glasgow City have the highest rates of child poverty. Next one. So looking to earnings inequalities, we see that it's roughly average compared to the rest of Europe and has decreased since 2002, although it remains high. So you want to go back one? Thank you.
Sorry, my Zoom's being a bit erratic.
Oh, it's all right.
Which one was it on? Is it
This
that one?
That's perfect.
Yeah.
Yeah. So basically, you know, Scotland is roughly in the middle of the rest of Europe in terms of earnings inequality. On a positive note, we do have a lower level than the rest of the UK, and it's actually fallen. That's that blank gap in between the top bar and the bottom bar there. It's fallen since 2002 and 2018. So reading this, basically in 2002, the top 10% of full-time earners took home about 3.25 times what the bottom 10% took home. And this has declined to just about 3 times within that time period. One thing that we've noticed is that in the past 10 years, there's been a really big push in insecure work, really big growth there. Think of things like the gig economy, delivery drivers, Uber drivers, that sort of thing, and agency employment. And just as a quick aside, in case you've been wondering what my accent is, this is my country at the very extreme end. One thing in writing this report is that it has been really encouraging to see a lot of the stuff that Scotland has done to improve things. And every once in a while, when things seemed really bleak, I could just look at what the United States was doing and feel really privileged that I get to live here and that we're, you know, continuing to move in the right direction here in Scotland. And even though there's still a lot of work to be done. So we want to go to the next one. Which is going to be on education. So there are these large gaps in educational attainment between pupils living in the most and least deprived region in Scotland. And these disparities begin from the time that they enter school. Primary school children from the most deprived regions scored significantly worse on things like numeracy and literacy. I think there was a 25 percentage point gap between the most privileged children and the least privileged children in literacy after, once they leave primary school. So it's a huge difference between these two. And looking at higher education standards or higher education attainment, which is this chart over here, 65% of students from the least deprived parts of Scotland entered higher education in 2020, compared to under 30% in the most deprived areas. So it's 25 points difference between those two again. This gap has declined over 10 years, which is really encouraging, but there are noticeable persistent differences, and there are some things that have worsened throughout the course of the pandemic. Next one. So on a positive note, to look at housing costs as a proportion of income are actually lower than the rest of the UK on average, which does offer a lot of protection for people who are in the lowest income earners. But these gaps in housing costs have grown. Again, as this chart shows, so that top red line, that's going to be the housing cost as a proportion of income for the lowest earning 20% of households, which is really stagnated compared to the remaining 80%. And in fact, we've seen that they're kind of higher than they had been throughout the rest of the last 20 years. And then if we move on to health spending and austerity impacts on the next slide there, we found that health spending has really stagnated since 2008, barring this really large increase in spending due to the pandemic. Austerity has been a contributing factor in the slowdown in health improvement. It's not the only factor, but it's one that we did look into quite closely. And it's really different. It's really difficult to separate how much things like income stagnation, decreases in Social Security spending, and this slowdown in health spending did to actually affect public health. But there are a lot of indicators that austerity did lead to health impacts. For instance, Social Security changes are linked to an increase in mental health issues among adults, which I think is actually my next slide if you want to go to ahead. You want to go to the next one? Thank you. So one aspect of austerity has been sort of the reprioritization of health funding within NHS boards. In general, funding cuts since the austerity period, beginning around 2010, have affected both the deprived and non-deprived regions pretty similarly. But funding has been reallocated to prioritize more densely populated regions, such as Glasgow and Tayside and Lothian. So the areas around Glasgow and Edinburgh saw about a 20% increase in real funding per person between 2010 and 2019. What we found is that this is likely due to a trend in offering more specialized forms of healthcare, which tends to be more available, more concentrated in cities. It also has to do with advancements in technology and manufacturing. So these declines in health spending that we're seeing in these more rural areas are not necessarily coming down to, less availability of healthcare. It's just the cost of that healthcare has likely gone down for basic healthcare that you would get in that area since 2010. So looking to, our next slide, looking at COVID impacts more closely. Obviously, it's unsurprising that it really severely impacted Scottish health. Notably, mortality rates due to COVID were the highest among the most deprived areas of Scotland. Was about 2 times the rate of mortality between the most deprived and the least deprived regions, even when we account for things like age and illnesses and all that. And the big reason for this is socioeconomic factors, which influence the levels of vulnerability and the likelihood of exposure. So this includes things like the types of work that are common in the most deprived areas, which might be more social, less likely to go remote. Population density also comes down to it. Nonetheless, very clearly a huge impact for those less privileged regions. Let's go to the next one. So aside from the obvious direct impacts of COVID, the legacy of COVID is going to be really interesting to watch. In particularly, long-term socioeconomic impacts are still actually pretty unclear. It did result in significant increases in inequalities in attainment, like I said, significant disparities in wealth, but it didn't actually change the structure of the labor market as much as was anticipated early on. One area that people have been really keen to watch has been employment rates among certain groups. People with fewer qualifications left the workforce at unequal rates, and a lot of older adults have opted for an early retirement, which is adding a lot of pressure to the labor shortage that we're seeing currently. Let's move into cost of living crisis. The increase in inequalities caused by the pandemic might be amplified by the current cost of living crisis, since low-income households are much more likely to be affected by inflation than high-income households. And this is because a really high proportion of lower-income households are spent on things like transport, energy, and food, all of which are really highly sensitive to price changes. So this chart shows what proportion each quintile spent on energy in 2019. So the average household in the lowest income bracket spent nearly 15% of their income on energy, compared to the highest earning, which only spent around 5% on, energy, lighting, and keeping their houses warm. And obviously, the UK government did a lot to, has announced a lot of potential interventions to mitigate the cost of living crisis and help with energy costs, but they don't come close to fully offsetting the impact of real income falls that a lot of households are feeling right now. So anyways, to wrap up, overall health is shaped by social and economic conditions, with inequalities in these areas strongly related to inequalities in health. And Scotland is shaped by remarkably high health inequalities, which have not really seen any improvement since around 2012. And it's pretty unique in the Western world in this regard. I think Scotland has one of the worst mortality rates in Western Europe. and really hasn't seen any change in this in about 10 years. It also seen persistently high income inequalities and has seen earnings and social service spending stagnate over this time period. And this isn't coincidental, right? These trends are intrinsically linked to each other. So, in addressing these gaps can help reduce Scotland's significant health inequalities, which can help improve this trend of shorter lives. But more importantly, can improve the quality of life and the extent to which we're able to live healthy lives here in Scotland. So thank you, that's me.
Thank you, Alison. That was really interesting. That was, really interesting to hear. And sorry about the confusion with the slides. But yeah, I guess if anyone's got any kind of questions now directly to Alison on that, then if you want to raise your hand or put anything in the box. Otherwise, I might introduce our next speaker, which is Kenneth Muir from Morphfit. I won't introduce you too much, Kenneth, because I can let you do that. Probably do a lot better job. But I'll just get the slides up now, and then you can go ahead. Bear with me. Don't know if you can see. Can you see the slides?
I think it was just taking a minute. Georgie, they're there now.
Nice. Kenneth, over to you then.
Thank you, Georgie. Good morning. My name is Kenneth Muir. Thank you very much for inviting the Morphfit Gentle Movement Project along to the webinar today. We're delighted to share our social enterprise story and journey to date, and how we work within the local community and how we try to integrate within the local community, and addressing some of the issues that you've just heard from Alison as well. And our goal throughout is just to help as many vulnerable populations as we possibly can. Okay, thank you. Next slide, please. So a wee bit of an overview in the background to who we are and what we did. You can see in the picture there, that's actually our facility. It's a kind of working picture there of how we work with all the different populations. That's part of the Healthy Aging Initiative in that particular shot there. But the Morphfit Gentle Movement Project was launched in May 2020, purely as a pilot online gentle movement service, as all operations went into lockdown and facilities closed and people weren't able to get access anymore to essential services. Our aim was to help as many vulnerable populations exercise safely and effectively via our digital platform at the time, or at our purpose-built facility in Hamilton, which obviously as lockdown started to lift, we were able to integrate that back into the option as well. You could either do it online or come on to an on-site service. And we're based in Lanarkshire, and it's all based through gentle movement exercises. We were aware that social interaction was going to be as important as the physical exercise, as all health, fitness and rehabilitation services started to get suspended due to COVID. Morphfit has grown from being a volunteer-based organisation delivering online physical and social interaction services to employing 3 staff members with 3 additional volunteers now. Okay, thank you. Next slide. Our team to date includes myself as operational director. Nicola, you can see in the picture with the Stookie on, she actually broke her foot just before we started working with this group. So we've got our on-site and online fitness instructor specialist, that's Nicola, our community engagement and fundraising officer, data collection and admin assistant volunteer, a practice nurse who's also a volunteer, and a social media and fitness assistant who again is a volunteer. And I'm pleased to announce that our data collection and admin assistant is going to actually become a full-time position in the coming weeks. Okay, thank you. Next slide. We have grown from supporting a handful of clients on a weekly basis to over 100 clients and patients per week, referred from care homes, social and community hubs, right through to NHS health centres via community prescribers, practice nurses, doctors and consultants. We currently work in collaboration with 7 health centres, with the majority based in Lanarkshire. The furthest is based in Edinburgh, who have the option to refer and connect to our digital online platform. Thank you. Next slide. As we moved out of lockdown, we discovered that many populations were unable to resume with original services due to ongoing restrictions and capacity restraints. This left many people, we found, anxious, frustrated, and concerned for their mental and physical well-being. As our team started to grow, we have been able to diversify into new populations, ranging from the elderly to more specific gentle movement populations, with programs that are designed to help groups such as carers, MS patients, cancer patients, cardiac patients, patients with Parkinson's, and patients who are based in care homes. Thank you. Next slide. Today, all programs have been delivered at no cost to the service user, which is a key part of our service, allowing us to help as many disadvantaged populations as possible. That's something going forward that we're very passionate about, that we're hoping to keep that same model in place. We have been predominantly funded by the following organisations: Foundation Scotland, CORA, Versus Arthritis, FASLAN, National Lottery, and Innovate UK. Innovate UK was our largest funder to date, and we did find out about that actual initiative through a webinar on this very platform as well, and allowed us to make more inquiries, and we actually won that for Scotland, and we were able to roll out the Healthy Ageing Initiative based on that. We also trade commercially with other third sector organisations who pay for their service users to log on or attend the gentle movement classes. Thank you. Next slide. We thought it might be interesting for you to see the sort of the range and diversity of who we help and who we work with. So we've prepared a couple of wee case studies to share with you as well. In this particular instance, it's a 34-year-old lady, Mary, who was diagnosed with secondary metastatic breast cancer in the bone. A diagnosis can alter so many aspects of a person's life. Mary's whole day-to-day routine changed drastically, and these sessions bring about a sense of normality. This is all based in Mary's own words. This is her case study. Returning to exercise was a natural transition, and she viewed this as the next stage of her journey, having gone as far as she could with physiotherapy. This was something she felt ready to push forward with. She explains that she knew her body was ready to return to movement, and her familiarity with it really supported her in bouncing back. The sessions are pitched just right for her, and she appreciates instructor Nicola's experience, awareness, and ability to guide the group. And in her own words, Nicola is a complete expert. She just gets it. Next slide. Yeah. Another aspect of the sessions that Mary enjoys is socialising, which is it's big for everybody, no matter what group we're working with. It's a key element to everybody. She's formed friendships with her fellow participants and instructor Nicola. In addition to exercising together, the group are always happy to have a general chat and a laugh. The vibe is fun and light, and while she is safe in the knowledge that she is exercising safely and within her own parameters, it really could be any exercise class at any gym. Mary credits the programme with helping to alleviate and manage some of the trauma she has faced throughout her journey so far. And again, in her own words, the programme has positively impacted so many areas. It has turned what was a really bad situation around. Thank you. Next slide, please. So on the other side of the spectrum, we have a gentleman called David, who's aged 77 and has been sadly recently diagnosed with Parkinson's. David had led an active and healthy life. Little over a year ago, David contracted COVID. Worsening symptoms meant that he had to be hospitalised. Upon returning home and beginning his recovery, David became aware of his changes in his body. After some medical investigation, he was diagnosed with Parkinson's and rheumatoid arthritis. A person with Parkinson's disease can also experience a wide range of other physical and psychological symptoms such as balance and memory problems, anxiety and insomnia. Rheumatoid arthritis is a long-term condition that causes pain, swelling and stiffness in the joints. The condition usually affects, hang on, just that wee pop-ups, still my screen there, the hands, the feet and the wrist. Okay, can you, next slide please. So again, from David, keen to maintain his health and manage his symptoms, David met with his nurse who suggested that he should come to our program, the Morphfit Gentle Movement Project. Since enrolling in the program, David hasn't looked back. Only 3 months into his gentle movement journey, David feels freer and his walking has improved and notes it's great for getting you up and going. He describes the group as first class and instructor. Again, Nicola is a star. David also enjoys the social side of the sessions and always has a laugh and a joke with his fellow service users. Next slide, please. As always, we know we wouldn't be where we are and what we've achieved without a vast amount of help that we've received locally. And any time I've spoke with Social Enterprise Scotland, I've always highlighted that within our own area, Lanarkshire, South Lanarkshire specifically, we've had huge amounts of support to allow us to be able to do what we've already done. So we've made it a priority to network and engage with as many government, local authority and third sector organisations as possible in South Lanarkshire. We appreciate that our success to date is due to all the support and funding that we have received locally as well. And among the help we received, we acknowledge Business Gateway, E3, FASLAN, what else have we got? Thank you. Just Enterprise, South Lanarkshire Council, Inspirant, and again, Social Enterprise Scotland. So thank you to all these people who are able to provide the services that we do. Next slide, please. Over the course of the last couple of years, we've had a few achievements along the way. We were FASLAN Social Enterprise winners for enterprise and innovation in this area in 2021. Social Enterprise Scotland finalists for health and social care in 22. We Innovate UK winners for Scotland, Healthy Ageing Initiative. Again, that was the project that we became aware of through Social Enterprise Scotland. We've had a motion logged in Parliament highlighting the Morphfit community work in South Lanarkshire. We've had another motion logged in Parliament highlighting the dedicated work of our fitness specialist Nicola and how she adapts all the programmes specifically to all the different populations. We were selected for the South Lanarkshire Council Accelerator Programme, and we were proud to be asked by Social Enterprise Scotland to host the Community Learning Exchange, which will be coming up in the coming weeks. Thank you. Next slide, please. So future plans, we're committed to becoming a commercially sustainable business with a 50-50 split target by the end of this year and an 80-20 split by the end of 2024. We aim to continue to work in collaboration with the NHS Trust, health centres, both local and further afield, offering a solution that will allow them to refer patients for gentle movement services at no cost to the service user. We are aware that there are many barriers within local communities preventing many people from essential mental and physical interventions. And at the moment, we are currently working with Just Enterprise and Inspiring on a commercially sustainable business model, which is going to be aimed at helping the people above. Okay, last slide, please. Again, we've obviously not on the same scale as what you've already heard, but we have conducted our own research, and again, in conjunction with organisations like Just Enterprise and Inspirant. But research shows us as well that health centres in deprived areas receive the largest financial support, which will be allocated to help the patients with comorbidities such as diabetes, obesity, high blood pressure and high cholesterol, all conditions that can be controlled with lifestyle intervention programmes. Our aim is to offer collaborative working partnerships and have the NHS refer patients to the Morphfit lifestyle intervention programme. We're aware of the many barriers to accessing essential services. Prevention is the key to help with the NHS capacity constraints. Morphfit are trying to be part of the solution by helping to reduce waiting times, improving patient experience and reducing NHS overheads. And finally, we have plans in place now for pop-up hubs in surrounding areas to help as many populations as possible, and hope to launch our first pop-up hub in March 2023, which will be in East Kilbride. And that's me. Thank you.
Thanks, Kenneth. That was really interesting. It was really great to hear. And it's nice to know about your future plans as well. I think there were some questions in the chat box whilst we were going along. So I don't know if we want to go through some of those. Alison, I don't know if you see the question from Snow about your thoughts on finding how the poverty and health inequalities are tied to family separation and the care system.
Yeah, that was a really interesting question. So I think I'll preface it by saying I don't have a great answer for it, because I'm not entirely sure the extent to which there's research in Scotland about, the degree to which family separation in the care system. I guess, as economists, what we would want to do is we would want to see how much monetarily or socially that being in poverty affects poverty later in life. So what we do know, though, is that poverty and work access are quite generational. If your parents are in poverty, you yourself are more likely to be in poverty. If one of your parents goes to prison, you yourself are more likely to be in prison later in life. If you grew up in a household without work, you yourself are more likely to struggle to find work as an adult, and you're more likely to be in low paid work. On top of that, adverse events like family separation, which I guess in probably a lot of fields, we would call those ACEs, like adverse childhood events. We know that those strongly affect health and work outcomes later in life. But the exact degree to which those do, I don't know, but it's quite interesting to think about, because it definitely does, I guess, those things. I guess, and we are doing a little bit of work on costing out social care that's going to be out sometime later this year, along with some stuff. And we've done a little bit of work on like learning disabilities and how, I guess, going to Fiona's question, how people with learning disabilities and how carers' health are impacted by, I guess, having those disabilities. So I can put a link to what we've worked on. I think also, like, our report came out in conjunction with one from Glasgow University, which looks at the actual changes in health since devolution, not so much the socioeconomic determinants, but it does discuss what those health impacts actually look like. So that's what I have on that. Yes.
Great, thanks, Alison. I don't know if anyone had anything they wanted to kind of respond to that. I think Rhiannon is here from Greater Govan Hill magazine. Not to put you under pressure, Rhiannon, but I don't know if you wanted to come in and talk a bit about the project that you're working on.
Yes, sure. Hi, everybody. I'm also feeling a bit unwell today, so excuse my kind of bunged up voice. So I run Greater Govan Hill magazine, which for people that don't know is a community magazine in the south side of Glasgow. And the point of the magazine is to kind of work on, I guess, bringing the community together and providing a platform to voices that you don't typically hear in the media. We're really about the idea of empowerment that can come through kind of the sharing of knowledge and engaging of people with the journalistic processes, which can help to kind of share information that's about what's going on in the community. So last year, we received some funding to work alongside the Ferret, who are an investigative journalism co-op who work across Scotland. And our project is about reporting on solutions to health inequalities. So it's really interesting to hear Alison talking about, the extent of the health inequalities that we obviously have here in Scotland. And we sort of started from that point, I guess, of recognising that there are some quite big issues that affect people's health, in varying levels depending on where they live or what services they have available to them. But the main kind of focus of our project is to report on the solutions. So things like Morphfit, in fact, are a brilliant kind of example of that. You know, the sort of the community solutions, or the kind of sometimes quite simple solutions that might exist in one neighborhood but don't exist in the next city because they haven't, you know, had the people that have been working on that idea for whatever reason. So because we're based in Govan Hill, we began our project with a big kind of community listening exercise in Govan Hill, where we spoke to lots of community organisations working with people from groups who may be marginalised or disadvantaged through different means. And then from that, we've identified a few kind of key issues which kept on coming up, which are things like access to healthcare, you know, whether through GPs or more specialised services, things around mental health, things around poor housing and cost of living, and that's an impact on people's health, and also looking at kind of gendered health issues, and then also looking at the positive impact that a strong community can have on people's health, again through different means. And so under those kind of main kind of themes, I guess, we're now starting to report on solutions. And although we began by kind of focusing in on Govan Hill, because we're working with the Ferret, and we're also partnering up with independent local media outlets around Scotland, we're really interested in hearing about what's happening across the whole of Scotland, in different communities and towns and villages, to kind of report on and showcase and highlight some of these solutions and approaches that exist that can help to mitigate the impacts of inequality on people's health, and to try and draw attention to them, to try and get them, you know, into the kind of the eyes and ears of the people that can fund these projects, or the policymakers that have the kind of the power to help them to spread. So I wanted to just have a few minutes just to tell you about the project that we're doing, and we'd love to hear about the solutions that you know about, the things that you might already be working on within your organisation, or maybe it's solutions that you've heard about that are, you know, are working in a different country or a different city. Anywhere around the world, really, we're quite interested in hearing about different solutions from different places that could have an impact here in Scotland. And we're really interested in focusing in on what works and why they work, and what lessons we can learn from those solutions or those responses to these inequalities problems. So I'll put my email address in the chat, and do just get in touch if you have things that you want to share that you think could make a difference to some of those inequalities that people are facing. And keep an eye. So we'll be publishing things on the Greater Govan Hill website. We're also working with the Ferret, so that we're publishing things on the Ferret Scotland website, and we're also, because the Ferret have a link with the Herald, so some of the stories are also getting featured in the Herald newspaper as well. So we'll be sharing our stories kind of throughout the next year under the title of Mind the Health Gap. So yeah, do follow along and get in touch if you have things or ideas that you think we should be writing about. Thank you.
Great, thanks, Rhiannon. And we can share your details as well in the kind of follow-up email, so if people kind of want to get in touch afterwards, and we'll send a link to the Mind the Gap information. But yeah, that sounds really good. There was a question there from Joanne about I don't know if you can see that. Do you have any sense of how early health outcomes in Scotland compare with outcomes in other parts of the UK? Alison or Kenneth or anyone, I don't know if you wanted to come in and if you've got any kind of response to that.
Alison, I'll leave that to you if you like.
Sure. So as far as early health outcomes, I guess I don't have a great sense depending on how early, but if we look to like young adults, you know, the mortality rate among young men in Scotland is significantly worse than anywhere else in Scotland, due to things like drug and alcohol related deaths, suicide, that sort of thing. I don't know about obesity rates off the top of my head, but you know, regardless of what's happening in childhood, Scotland has this real issue with healthy life expectancies. I think, again, like if you compare it to the rest of Western Europe, Scotland's life expectancy for men in particular is substantially worse than anywhere else. I think for parts of Glasgow, the like life expectancy for men is in the 50s. The next worst is in Portugal, where it's several years longer, and in England it's substantially longer across the entire country. So it's quite an interesting question, because I don't totally know how. It's weird, because Scotland does have high inequalities, but like I said, it's better than the rest of the UK. Scotland has actually higher average incomes than the rest of the UK, and it has with the lower household costs, people in poverty are better off in Scotland than they are in other parts of the country, and yet mortality rates are so much higher, drug rates are so much higher, and alcohol rates are so much higher. So yeah, that's a really interesting question. Thank you for posing.
Thanks, Alison. Yeah, just trying to keep up with the messages there. I don't know if anybody has any, maybe not questions or any kind of comments that they wanted to make. If so, feel free to put up your hand or put anything in the chat box. But yeah. Oh, there, Rhiannon, I can see the link to the gap there. But yeah, I suppose maybe if there's not much more, we might wrap the session up. But I'd just like to say a huge thank you to our speakers, Alison and Kenneth and Rhiannon. It's really useful to hear from all of you. Hopefully that kind of sharing knowledge is great. But yeah, I'll be sending through the links and people's details after this. So if anyone wants to get in touch, then please do. But otherwise, yeah, thank you very much for joining us this morning. If anyone has any questions, just get in touch afterwards.